In this video, I will reveal what could be lurking behind your most common foot problems. I will also show you what it may mean about your general health and what you can do about it. Let's get straight into it. Number 1, sudden hair loss on the feet and toes. What this might mean is you have a serious circulation problem. You may not think having hair on your toes is a good thing, especially during sandal season, but having hair on your toes is actually a good thing. So get it checked out. Sudden baldness can be a sign that your feet aren't getting enough blood flow to sustain hair growth. Expect your doctor to check for a pulse in your feet, which is an indication that your heart may not be able to pump enough blood to your feet. Number 2, you feel frequent foot cramping. Well, what this may mean is you're suffering from either dehydration or nutritional deficiencies. Randomly occurring cramps are extremely common in the feet, so don't get too worried. They can be as serious as circulation and nerve issues, or as harmless as a nutritional deficiency. If you're exercising, be sure to drink plenty of water, since dehydration often leads to muscle cramping. You might also try upping your intake of potassium, magnesium and calcium, with your doctor's go-ahead of course, since their deficiencies make cramps more common. Or if you like, try for relief soaking your feet in a warm foot bath and stretching your toes towards your nose and not pointing downwards. If the cramps don't let up, see your doctor who can test for circulation issues or nerve damage. Number 3, a sore that won't heal. What this may mean? Well, it's probably a sore that's taken time to heal, but it also could mean you have diabetes or skin cancer. Stubborn sores are red flags for diabetes. Uncontrolled glucose levels in the blood can lead to nerve damage all the way down to your feet, which means any cuts, sores or scrapes can come and go without you ever feeling it. If infection sets in, you could be in trouble. A non-healing wound can be a sign of skin cancer as well. Melanoma can pop up anywhere on your body, even in between your toes, so be sure to include your feet in any regular skin checks. Number 4, constantly cold feet. Well, this may mean you're suffering from hypothyroidism, and this is the most common cause of feet that just can't get warm. If you're over 40, you could be living with a sluggish thyroid without even knowing it. Unfortunately, cold feet are the least of your problems. Hypothyroidism can also cause hair loss, fatigue, unexplained weight gain, and depression. So get your feet feeling toasty again by heading to your doctor for a simple blood test. And you can start warming up shortly after taking some simple medication daily. Number 5, a sudden enlarged big toe. What it may mean? Well, you could be suffering from gout or some other inflammatory issue. If you have the sudden onset of a red, hot, swollen or painful joint, then get immediate medical attention. It's probably nothing, or it may be something more serious such as gout, inflammatory arthritis, infection or trauma. Number 6, bunions. What this may mean? Well, it can be an inherited faulty foot structure. If you thought your bunions were caused exclusively by a closet full of gorgeous yet restrictive and often painful shoes, you can stop blaming the boutique, because bunions are actually a sign of a flawed foot structure that's often inherited and aggravated by inappropriate shoes. Number 7, heel pain, especially in the morning. Well, this may mean you're suffering from plantar fasciitis. You can't mistake it. It's a sharp pain at the bottom of the heel when you get out of bed or stand up from a chair. It's a strain on the ligament that supports the arch of the foot. Whether you did this by wearing too tight shoes, walking in flip-flops or wearing worn-out workout trainers, the longer you let it go, the longer it can take to heal. Your podiatrist will probably tell you to ease up walking at first. Rethink your footwear and adopt a good stretching routine. Number 8, flaky itching or peeling skin. What this may mean? Well, you're probably suffering from a fungal infection. Even if you've never donned an athletic jersey in your life, you could still be walking around with athlete's foot, which is basically a fungal infection caught in the swimming pool or anywhere where you walk bare feet along with other people. It causes itchiness and peeling and can be treated by applying antifungal cream and keeping your feet as cool and dry as possible during the day. If you're fungus free, you might be dealing with eczema or psoriasis. Both of these can be determined by a simple skin sample. Number 9. What if you're suffering from yellow toenails? Well, it's probably caused by age. Naturally, over time, your nails will go a yellowish color as you get older. However, if it's accompanied by brittleness or flaking, it's most likely you have a fungal infection, like an athlete's